Medicaid and public health are within the same umbrella agency in Louisiana, the Department of Health and Hospitals. But historically, they've operated in silos and had minimum necessary interaction between the two. Over the last couple of years, the relationship between Medicaid and public health has changed radically as we work collaboratively and proactively to improve health on multiple initiatives in the state. One definition of culture is the way we do things around here. In our case, this is in state government agencies, and that is definitely changing as we see continuous improvement and identify areas in which we can collectively share each other's intellectual property and resources and data. For me, culture is not a policy, but it's the way we actually do things in practice. And that is absolutely changing for both Medicaid and public health as we work together. I know we have a far greater appreciation for each other's strengths and what each of us brings to the table as we work to improve health outcomes. Our increasing collaboration was driven by the recognition that public health would be a major player in helping us to address the health disparities that we had noted in birth weights in Louisiana. Neonatal intensive care unit costs are a big driver for Medicaid in Louisiana. And so we worked with public health, looked at their data, and they worked jointly with us. We actually are extracting information today from birth certificates in Louisiana to identify women who have given birth to a previous low birth weight newborn. And then we are reaching out to those members. Our Medicaid managed care plans are reaching out to those members for interventions, including antenatal progesterone. The current state of collaboration was driven initially by my counterpart in the Office of Public Health, J.T. Lane, and myself being of like minds and seeing the opportunities that existed. But we know that it is going to be sustained because of the successes we've experienced, because of the recognition of our senior staffs and our hundreds of employees and contractors that the sum is better than the parts, and we make great natural partners, and that at the end of the day is our sense of pride, collective pride in improving health of Louisiana residents, and that is our ultimate goal both in public health and in Medicaid.